Chronic obstructive pulmonary disease. What is it? Chronic obstructive pulmonary disease is a group of long-term lung conditions. Diseases can include refractory asthma, bronchitis, and emphysema, which are usually the most persistent in people. Bronchitis and emphysema can sometimes even occur together, making it difficult to empty air out of the lungs due to narrowed airways. Take a minute to just read this. Pause if necessary. Chronic bronchitis. Bronchi tubes are tubes in which air goes through to get to the lungs. If these become inflamed, the tubes become narrow, making it more difficult for the air to get through. This will result with difficulty in breathing as the air cannot get into the lungs. The disease is known as bronchitis and can be split into acute or chronic. Acute can be cured via medication such as aspirin and fluids, and is usually gone within a couple of days or weeks. Chronic, however, is usually a long-term disease and will usually be part of the person's lifestyle. Chronic bronchitis falls under the COPD. This is what our patient has. Chronic bronchitis. Inflammation in the bronchial tubes can cause a buildup of mucus. This can result in a cough or shortness of breath, where mucus or phlegm is usually coughed up. If this cough lasts for more than 3 months, it is no longer acute bronchitis and chronic bronchitis. This is usually caused by inhaling harmful substances, usually by smoking or air pollution. Other conditions under COPD, emphysema. This lung condition is where the air sacs at the end of the airways in your lung become damaged with holes. These holes can trap air in the lungs, making it harder to move air in and out. They also lose their elasticity and become baggy, resulting in a loss of their efficiency. These air sacs are called alveoli, and any damage to them are usually irreversible. Refractory asthma. This is a specific type of asthma that does not improve when using a standard treatment and therapy, for example, salbutamol inhalers. Due to this, people who have severe asthma have persistent symptoms, such as frequent asthma attacks. These symptoms are therefore more difficult to control than regular asthma. Take a minute to read this and pause if you need to. Treatment. Oxygen. Your healthcare team can recommend a specialist to see if oxygen may be of help to you. People who have low oxygen levels are usually the ones that have this type of treatment recommended to them. Oxygen is not a treatment for breathlessness, which is usually a symptom of COPD. Lung volume reduction surgery. Various people with emphysema may benefit from surgery to remove parts of the lungs that have been severely affected. This can result with the lungs working better as only the healthy parts remain. Non-invasive ventilation. This type of treatment is most likely offered if you are admitted into hospital due to a severe flare-up. This treatment involves wearing a nasal cannula, where a soft tube is inserted into your nose, or you can also have the option to wear a face mask, which is connected to a machine which pushes air into your lungs. Lung transplant. People with severe COPD that have not gotten better with treatment might be a candidate for a lung transplant. This can be depending on your age, any other illnesses, and what your results with the other tests would be. This is usually a last resort, as the lung transplant is a high-risk operation. Due to the high risk, only a small number of people are suitable for it. Suitable organ donors are also very small in numbers. Take a minute to read the next few slides if required. Further help. Living with the condition does not have to be handled alone. There are support groups that can help make things easier, where you can meet people and have the same condition as you or experiencing similar things. British Lung Foundation. Breathe Easy support groups. This support group allows you to find support in your local area. It allows you to make new friends, which can meet regularly. You can listen to stories or tell your own. Health Unlocked. This is part of the British Lung Foundation. This includes a forum/chat room where you can post anything, members can reply or start a conversation. This can be helpful when interacting with your friends.